Okay, so Monique's talked through the different stages of labour, and I'm just going to do a quick discussion about different things you can do around your labour and your birth plan, and things that are becoming more popular now. So one thing is that we're seeing a lot more now is the cord ties. So instead of the plastic clamps, it is a flax cord tie, and that can be used instead. You can either have it plain like this one, or you can get it with like little gemstones and things put on the end. And there are quite a few companies that do them, so get online and have a look if that's something you're interested in, and talk to your midwife as well. She might know people who do them. And more people now are also going with lotus birth. So instead of cutting the cord, it's left attached. So for 5 to 8 days, however long it takes for the cord to come away, you're actually carrying around the placenta in a bag and the baby. So you need to wash it and salt it and herb it every day so it doesn't get too smelly, but you have the baby snuggled up, and then you have either a little basket or a bag with the placenta in. And there's lots of theories behind it, but it's like they have been won for 9 months, and so it's a case of the baby releases the cord and the placenta, when they're ready to do that. Another thing you can do for cutting the cord is if you wear like a greenstone, you can get those sharpened up and use that to actually cut the cord with as well. So there's different options around the birthing and the cord and all that sort of thing. So have a chat, see what you think, talk to your midwife and put it in your birth plan. If you're planning a water birth, we've got the 2 birthing pools up at the hospital. If you're at home, you can hire pools and do that at home as well. With a water birth, it's a lot more hands-off. If you had, in the hospital pools, they're big enough that your partner can get in with you as well, but please make sure they wear something, togs or undies or something. Naked women, part of the job, naked men is just entertainment. So, water birth. With this, the midwife can watch progress. She can hold a mirror under the water and watch dilation, and as the baby's coming through that vagina, she can see the baby's head coming and going as the vagina opens and closes, and then once she gets that stretched, the water really helps with that stretching of the skin to get the head out, and the baby comes out and the head's out. We don't touch them at all because we don't want to stimulate them to breathe underwater. Just wait for them to turn and you do that final push, and out they come. And you can pick baby up yourself, your partner, anyone else in the room can pick baby up. And it's as they come out of the water, the temperature change and the pressure change is when they take that first breath. And they're nice and clean as well. They've had a little wash on the way. So if labour's happening a little bit fast, which doesn't usually happen with your first baby, but sometimes can happen with subsequent babies because you're expecting the same and it's not. So if things are happening really fast, what you need to do, best thing, stay at home, phone your midwife. Your midwife usually has 2 phones. She can be talking you through things, and she can phone the ambulance and organise them to get to you, or another midwife who's close by. You basically make a little nesting space on a nice, easy, clean surface. So kitchen floor, wooden floor, nice, easy, clean anyway. Get some old sheets and towels and make a little nesting area for mum. And basically when she starts pushing, you're just going to be ready to catch. If they're coming fast, they'll be fine. So once baby's head's out, you don't need to do anything to them. You just wait for them to turn and do that final push. And then you put them up onto mum, skin to skin, with towels and blankets, whatever you've got handy to keep them warm. Don't pull on the cord, don't cut the cord. If the cord's only short, just put baby where they can be, but skin to keep them nice and warm. When the placenta comes away, catch it in whatever you've got handy. Help will arrive, but like I say, if it's fast, it'll be fine. And they'll probably be a bit stunned, so just rub them down, talk to them, stimulate them to breathe, and everything will be fine. If you're already in the car on the way to the hospital, pull over by some kind of landmark where people can find you. And the same thing, you're going to catch. Take off your t-shirt or top that's nice and warm, rub baby down and then put them up mum's top to keep them warm. And same thing, catch the placenta if it comes away and just wait for help.